At the Mount Sinai Adolescent Health Center, we provide free services to the patient at no cost to them. On average, we spend about $1,000 per year for all those services that they receive. All those comprehensive services. We also buy their medication, and we give them Metro cards so that there is no barriers. And because only 30% of the teenagers that come to us, the young people that come to us, have Medicaid. If they have Medicaid, we bill Medicaid, but we have to raise a lot of money. So our budget for the year is $10 million. So we raise the money to be able to provide all the services that they need, integrated, and not worry about the fact that they do not have money or insurance. The Mount Sinai Adolescent Health Center has had a long history of partnering with schools, and we partner in different ways. One is that we have, within 6 high schools in Manhattan, we have full-time clinics. So right inside the school building, we have clinics where we provide medical, mental health, sexual health, so all the components. And we also can go to the classroom if the teacher requests that. So very strong working relationship with schools. We also have young people that we train to be leaders. We have a peer health education program that work in different types of schools in New York. And they go into the classroom and work with young people on an array of issues, including how to prevent HIV infection, how to make good decisions about trauma. And they go with the staff, and it's very effective because it's young people talking to young people. We also, many schools send young people to us. We feel that parents are really key. Young people have the right to confidential services, and we honor that, and that's very important to us. And that's why so many young people come. But we also understand that young people do much better when their parents love them, when their parents are involved in their care, when they can communicate with their parents. So we actually encourage parents to come and bring their children. We encourage young people to talk to their parents. And sometimes the young person may say to us, well, we cannot say that to my mom or my dad. They will kill me. And we say, no, they will not kill you. Bring them here. We will help you tell them whatever the issue is. And the young person has that option to bring the parents to the clinic, and then we help them tell. But we really are major partners with parents. We also do family therapy. Usually the family therapy involves the adolescent that we serve, and also whoever is in their families. It could be a mom, it could be a dad, it could be both parents, it could be a grandparent, all the siblings. So we really think that family is very important. And the healthier the family is, the healthier the young person will be. We reach the most vulnerable and disconnected young people. And the reason that we are able to do that is because of the way we design our services. We make it easy for everyone to be able to come in. Public school, private school, and the specialized high schools. And the teachers and guidance counselors and other professionals in the schools send patients to us all the time because they understand that a young person will be more ready to learn in school if their needs are met, whether they are physical needs or they are mental health needs. They know we will not judge them, whatever is happening in their life. We meet them where they are. We know, we come with plans and things like that, but we make sure that we meet their needs. What we have learned working with young people is that we need to ask them direct questions. And if we do, and we ask them in a sensitive way that they know we are there just to help them, they are like an open book and they will tell us. And what we do is that before I even take the history, after I explain that everything is confidential to the young person and their family, if the family came with them, I will say something like, I'll be asking you a lot of different questions. We ask those questions from everyone, just in case any one of our patients has experienced that. So it's not that we're picking up anything from you, and that's why we're asking those questions. So just be aware that we are going to be asking you lots of different type of questions, but we ask every single patient the same thing. It's just to make sure that those that have experienced those things really we'll be able to share that and then get help for that. You really need to strive for equity. You need to really give these young people the steps that they can climb to get to where they need to be. And the way you do that is by providing team-friendly services, youth-friendly services, and providing all the different trauma-informed services that they need, of mental health, everything, and working with them in a way that they heal from their trauma and they are able to deal with the different disparities. Another challenge that we face is the lack of awareness of the needs of young people in terms of the type of services that they need. People try to send them to a biomedical type of approach, and that just doesn't work. And the funding often doesn't incorporate prevention and really doing the type of work, the intensity of the work that is needed to address some of the disparities and to really achieve equity. And it is really important because the funding itself is silo. And at some point, it will be important to try to figure out how do we develop maybe a youth-specific funding mechanism that incorporates all the things that we see, because it's in the same kids that we are seeing all the things, but also that go from wellness to prevention, health education, risk reduction, and treatment. So the full range of scope that I think is needed, because these young people really can do very, very well. We need to really think about the social, political, economic context that leads to the disparities, and then figure out how to fix it so that people can really maximize their outcome and do well. Another issue is training. When people go to medical school or psychology school or nursing school or social work school, they are not necessarily learning how to work with young people. So training is a major issue. And just to give you the example in medicine, in adolescent medicine people, it's only like 800 of us. So there are about 26 programs in the country, and every program puts 1 or 2 people who graduate every year. So that is not enough that's not enough adolescent medicine people. You know, there are wonderful pediatricians and family physicians, and actually the majority of youth are seen by those other disciplines, but even them, I think, need additional training. I think we all should be receiving training on how to work with young people. The administrators should be receiving training on how to set a program that are appropriate for young people, that is going to make it easy for them to come and utilize those services. The financial mechanism need to be rethought and maybe integrated the same way those services are being integrated. And I think with all these things, the system will be much more efficient and the outcomes will be much better. We use different lenses. One is a social justice lens. Another one is a positive youth development lens. We actually see the young people as full of promise. They have many assets. These young people are smart, they are creative, they're hardworking, and even when they have such challenging lives, they are really trying to do the right thing. Sometimes I work with patients that I wonder, how does this kid get out of bed? Much less go to school, much less help with the chores in the house. You know, they work. They do really help people in, you know, they volunteer. So they have tremendous assets. And we need to really we need to reframe young people and start seeing them by the positive assets that they have, use positive youth development principles, and deal with the issues and the challenges and address them. But really, this should be more about wellness, about how these young people maximize their potential.